Hi there, welcome to a presentation by CBH Education in our pharmacy revision series. Today we're going to be talking about bisphosphonates. Now you'll see bisphosphonates prescribed to patients all the time. One of the most commonly prescribed drugs, alendronic acid, sodium residuate, and ibandronic acid. Ibandronic acid you tend to see in patients who usually take it the tablet once a month. These tablets are taken once weekly, so like methotrexate is really pertinent to ensure that when you're dispensing, there is once weekly on the prescription, and patients are aware of this as well. So, bisphosphonates reduce bone turnover by inhibiting the action of osteoclasts, the cells required for bone reabsorption. Side effects: osophagitis, so basically upper GI disturbances; hyperphosphatemia, that's low phosphate. Now, your drug interactions, there's not really severe drug interactions, but basically it can decrease the absorption of calcium, antacids, and iron. So basically, it's really important that this is not taken together. So what you will find is typically patients who are on a bisphosphonate are usually prescribed calcium. Now, the go-to calcium formula at the moment within CCGs is Calci-D, because basically it's a once daily tablet. So it's advisable to make sure that they separate out the dose. Now, usually this dose is about 2 hour separation. Now, key monitoring is DEXA scan. U and E, absolutely essential in elderly patients. This is a common error that you see all the time. Patients with an eGFR of less than 35 mils per minute need to be stopped this medication as well. Now, if you're working in primary care, you'll see patients that will get a zoledronic acid infusion. And it's really important to document this as a hospital-only medication, because sometimes this can lead to confusion as well, of like when patients do have obviously osteoporosis, you think, okay, what bisphosphonate are they having? Are they having a bisphosphonate holiday? Are they having have they tried it before, an allergic reaction? So to avoid all of this, it's really key to document it, and this is usually present in the patient's clinic letters as well. Okay. This drug, these drugs, the bisphosphonates, are associated with a variety of MHRA warnings: atypical femoral fractures in patients with long-term treatment, osteochondrosis of the jaw with intravenous bisphosphonates. So this is why it is absolutely key to document that, so you are aware of the risks. And even if you're doing an audit as well, somebody gets osteochondrosis of the jaw, you can assimilate that and obviously report it to the clinic if need be, or the lead GP. And then obviously osteochondrosis of the auditory canal, and this is greater than not in therapy more than 2 years. Now, obviously, some of the counselling points is, or the key counselling points is, are patients with obviously esophageal symptoms, so esophageal things like esophageal intubation, dysphagia, worsening heartburn, pain on swallowing. Absolutely key then, if they're getting these symptoms, refer back to the GP. And if before you're initiating treatment, make sure that you check and replace the vitamin D. We are going to be doing a presentation on vitamin D and vitamin D replacement, insufficiency, deficiency, and looking at obviously the different parameters as well, and just using some of the latest localized guidelines to help you with that as well. Now, thank you very much for listening to this presentation by CBH Education. Further presentations on pharmacy drugs, pharmacology, OTC conditions, OTC medications, and also calculations, which we're going to be introducing. Please follow us on Facebook, Instagram, and YouTube.